Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we discuss journeys, experiences, and knowledge from successful medical practitioners. And today we have Dr. Neha Roy with us. She is a practicing family physician in Delhi NCR, and that's it. She's here to tell us about her journey, why did she pick up this family medicine, and what interesting and challenges as well that she finds in a branch like family medicine. Welcome, Dr. Neha, to the platform. It's really nice to have you here.
Yeah, hi, good evening, everyone. Good evening, Dr. Ayushi. Just brief intro about this branch. Actually, people think that it's like kind of non-clinical and PSM. So I would tell guys that it's not like PSM. It's like a clinical branch related to internal medicine, like general medicine.
Hmm.
So family doctors are like general internists. It's a branch which can cater to peripheries with good expertise. And a family physician can take care of all the issues like which requires non-interventional care at a primary and secondary level as well.
Hmm. Hmm. Hmm.
So, and yes, and this branch provides basic knowledge related to subspecialties of the medicine, as we do have rotatory postings in these like gastro, cardiology, like these
All the
things.
branches. Yes, yes.
Yeah.
That's nice to know about family medicine. But why did you pick up family medicine is also one thing we want to ask.
Yeah, actually, I wanted to have medicine in Delhi NCR hospitals and colleges. But
Okay.
for me, medicine seats were blocked in Delhi NCR. So I
Uh,
opted
the
family
family
medicine.
medicine.
Yeah.
And after getting into it, how do you feel about the branch?
Yeah, I feel like this is a very good branch actually. I could see patients of all the specialities general I can get heart failure patients also. I can get diabetic patients also, kind of that. And
Mm-hmm. Yes,
so
that actually helps you to expand your horizons and to
yeah, that's
help
what.
you to treat all kinds of patients. You don't get stuck with one kind of thing. That is all the best thing, I believe. This
That's what.
branch. Yes, yes, yes.
So
So now, if you have already mentioned, what helped you to get into this branch and what led you to this. So if somebody wants to get into this branch, what are the academics that a person should do? According, because a family, please.
Because academically, because what do you want? What subjects do we study in this family medicine?
After MBBS, normally, because family medicine is a new, a new branch per se. It was never there in India, especially 5 years down the line.
Yeah.
People are now picking up family medicine, and as far as I know, there are very less colleges that offers masters in family medicine. So what are the colleges that you think are good and are offering, as you also did DNB? What is the difference between the two, and if somebody gets DNB, do you think that person should go for it? What is your idea behind it?
See, DNB is a very good kind of degree in family medicine. Like it's generally in corporate. If I am talking about the north, like
Hmm.
Delhi, NCR, it's available in corporate hospitals mostly,
Definitely. Hmm.
and very good corporate hospitals and the semi-government hospitals offer this degree, like Gangaram, like Artemis, as I did from Artemis
Yes,
hospitals.
definitely.
And we have this Medanta also, we have this Max hospital also. So like once we go into this multi-speciality hospitals now, we learn lot many things actually. We are not confined to a single test. We have like a big horizon where we can learn many things actually,
Hmm, 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 hmm.
kind of.
Definitely.
So it's like good to opt for this degree actually. And in south also there are many colleges in Bangalore, they are offering this degree.
Hmm.
So generally what students should go for, if they're going for corporate hospitals, they should look for big metros actually, like Bangalore, like Delhi. So like peripheries also they're there. It's in small hospitals also there, but then we don't get that much of input, and
And
it's always
exposure.
yeah, it's always some foundations, something kind of that.
Definitely. It's, it's better to have a broader exposure than a, limited one. So you correctly said. So when it comes to masters, what are the good colleges that you think that people can pick family medicine for?
Mostly in Delhi, it's Gangaram is the best one,
Hmm.
and apart from that, we have Max. Max is also good,
Okay.
and yeah, in Bangalore, it's like Vaidehi is also
Hmm.
giving
Hmm.
in medical colleges they're
Yes,
giving.
colleges. Definitely.
AIMS also have this like nowadays they AIMS Rishikesh also started this branch. AIMS
Definitely.
Delhi also having this. So they're
Mm-hmm.
good branches there.
Yes, yes, yes. No, after this, after doing your DNB, what are, because I know you are all, you have also done your fellowship in endocrinology. What are the different kind of fellowships that you will suggest people to pick up after doing masters, and which helps them to build that practice for themselves that they always want to? What is the kind of fellowships that they should opt for, and what are available actually?
So see, after actually the difference between medicine and family medicine is that we guys can't do DM. So we need to have some fellowships, which is available in critical care. We can do that,
Hmm.
and we have that geriatric medicine. In that we can do postgraduate diploma in geriatric medicine,
Hmm.
and this endocrinology and these things, and cardiology also, non-interventional cardiology also is
Hmm.
available.
We can
These
pick up.
yeah, family
Okay.
medicine guys can pick up this, and then they can like proceed accordingly, but
Hmm.
these all are non-interventional. Cardiology is
Or
non-interventional.
interventional, definitely. So now when it comes to which among these are, do you think are one of the, best fellowships that people can go for, that with the coming trend?
So they all are good, I think, except the critical care, because critical care requires little bit of exhaustive thing. You
Hmm.
have night duties, then you like it's a quite tough. In endocrine, it's totally. I found it very relaxing, and
Okay.
it's very good. Like I can take calls on phone also, like
Hmm.
regarding sugars, like anything. But it's not like
Hmm.
with critical care. And geriatric medicine is also a good thing
Hmm.
nowadays. Upcoming thing, which is like we have lot many oldies now. Like this is a COVID era, and see
Yes,
old,
yes, yes, yes.
and they are very prone for these lung infections. So it's also good. Yeah.
And especially now people are actually, getting educated with the geriatric healthcare also, so that way it helps you to build up your practice, I believe.
Yeah, yeah,
Yeah.
definitely.
Hmm. So that's good to know all of these. And if you can mention any good places for a person to pursue these.
See, basically, what is cardiology is available in Medanta, which is in Haryana, Gurgaon.
Uh-huh.
So that's a very good center for non-interventional cardiology course fellowship.
Hmm. Hmm.
Max also offering this,
Hmm.
and I guess yeah, Artemis also has this, but the best are this Max and Medanta. They are offering this, yes.
Hmm. Hmm.
And in critical care, we have Apollo hospitals, which
Hmm.
gives these fellowships in critical
Okay.
care.
Hmm.
Yeah.
Hmm. Hmm.
And
Okay.
this geriatric medicine is through IGNU. It's a
Okay.
fellowship through Indira Gandhi
Indira
Open
Gandhi
University.
Open University. And from where did you pursue endocrinology?
It's
Endocrinology.
like a online course which I did it from through it is affiliated to Royal College of Physician, University of South Wales, UK.
Uh-huh.
Yeah. So through
Okay.
that.
Okay. Okay. And how was your experience with that? How
Yeah,
did you?
It was very good actually. So it's a totally online course.
Okay.
I like we have tutors from abroad, like
Hmm.
mostly settled in London hospitals, like UK hospitals.
Hmm.
So they it was good actually. Good. They put clinical scenarios and they cover all the topics related to endocrine. So
Okay. Okay.
it was a good job.
Just wanted to get a bit into the course. How long is the course, and how did the course structure go?
It is 1 year. 1 year diploma is 1 year. Then next, if I would like to go for MSc, then
Hmm.
it's 1 year. Both we have in that.
Okay. Okay.
So, but then for getting done into this course, it's like we need to have there some uh, what do you say? They have some criteria actually.
Hmm.
Some English. They want some IELTS band. IELTS is there, na? They have that
Yes,
English.
yes, 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 yes.
Yeah,
You
they
clear
want.
the IELTS band before going for the course.
Yeah, so they want 7 band for that, and yeah, recommendation letters. So something.
Okay. 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 And the site name is that you just Southwest.
University, yeah, University of South Wales. It is.
University of Southwest.
South
Okay.
Wales.
Okay. And your experience has been really great with the same.
Yeah, I found it very nice, and I just built my confidence with this. It was like it was a boon to my practice actually.
Okay.
It
Okay.
was very good
Hmm.
course.
Hmm. That's really nice to know, actually, especially having such online courses help you to manage everything in
So,
with your
and
practice.
especially, yeah, and especially in this COVID era, so where we cannot, all colleges are like all totally online. It was already online course, so
Mm-hmm.
yes.
Yes, yes, yes. And online courses is something that I believe now are, people are getting interested into.
Yeah, yeah. So I think the time will come the next
Yes.
next decade. So that will be online. Medical colleges will also be online.
Let's
Yes.
see how does that happen. But yes, this is something, at least fellowships have started. That also is a very big thing, for practicing doctors also, this helps to manage
Yeah,
everything.
yeah. At least for family medicine guys, though they are very good to establish their practice, especially in the metros. They need these
So
people.
now coming to this, what are the kind of job opportunities that you figured out after moving out of your after your masters and fellowship? What
So
are the kind of job opportunities available for family medicine people?
So it's like family medicine can set up their own clinic if they want to go to peripheries or like small towns. They can where they have roots,
Hmm.
where they can get many patients, where they are locals. They know local people. They
Hmm.
can set up their practice. It's a very good thing. Or
Hmm.
else they can be in metros, like they can be attached to corporate hospitals. Then
Hmm.
accordingly, they have their designations getting higher.
Yes, 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 yes. So now, when you mention about about the peripheries as well as the metros,
Yes.
what do you think is the difference of settling down as a family medicine doctor between the two? In metros as well as the periphery. Is it that how? And you also picked up to settle down in metro. So, what is the difference between what is the kind of lifestyle and challenges that a person faces in both the places?
See, it's like in the metros, so it's always be challenging unless until you have then some extra fellowship, some extra degrees.
Hmm.
You need to be very justified in what you are prescribing. You because when a patient comes in a metro,
Hmm.
so they have googled it a lot about each and every medicine.
Hmm.
So we need to know in depth everything. But
Hmm.
in peripheries, like definitely we have to know what we are prescribing, but they're not very they don't know much about the basic things
Hmm.
about the medicine. So that is
Mhm,
the thing.
mhm, mhm,
And then so this is the point. And then again in peripheries, if we want to set up our clinic, so that is little bit easy because see it's a little bit cheaper.
definitely. Huh.
Yeah, we don't
Easier.
uh,
Financially, it's easier to set up your.
financially, yeah.
Yes.
But in
Yes.
metros, you know, first you need to be attached to a metro to get, sorry, a corporate hospital to get recognized.
For
Then
people to know you in that community and for you
so
people to
people
know you.
will come to know, oh, that doctor is from that big hospital, so they will
Hmm.
recognize.
Yes, yes, yes. And to build your clientele, that is very
Yeah,
important.
that's what.
Yes.
That's what.
So now, if you had an option of settling down in a periphery,
Mhm.
how is the life? Because a field like family medicine is attached to all kind of stratas, all kind of
Hmm.
you know
Hmm.
age groups.
Hmm.
So the is it if a person passes down, after masters, what do you think a person should pick up? Should that person go to a periphery, or you think that that person it's good opportunities there in metros that as you are practicing there? What are the place for a good opportunity?
So, like, depends on the person. Like, if he has good roots in the peripheries,
Hmm.
they have some initial setups at their native places, some peripheries. So they should definitely go there, and they can start their own practice.
Hmm.
And
Hmm.
that will be like much easier for them to get established once they have some small setup,
Hmm.
like their parents, like somebody known to them,
Hmm. Hmm.
like
Hmm.
that.
Hmm.
Because in metro we have to start from zero,
Yes, yes,
like
yes, yes,
that.
yes, 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 definitely.
Mhm.
And but yes, it's all about person's priority
Yeah,
wherever you.
yeah.
Yeah.
But the thing is that ki, and the thing is that ki lifestyle also.
Yes.
Generally, doctor, like if anybody wants ki lifestyle should also be good. So
Hmm.
it like.
In that case also, yes, yes. So now when it comes to, you have already mentioned about settling down into two places. What if a person wants to settle down outside India? What is the scope of that?
Yeah, they can go to any places, like actually it is easy to get settled in Middle East countries for Indian doctors,
Okay.
because they don't need extra degree. Like
Hmm.
family medicine will be valid there. We don't need extra degree there to
Achha.
get into their hospitals. But
Okay.
once we want to go to UK or US, then we need to have cleared their degrees actually. Like for
Yes.
US we have to do USMLE. So again, that we have three steps. And
Hmm.
if we want to go to UK, then also, yeah, we have to do MRCP. That's also in three steps. So
Yes,
so
yes,
kind of that.
yes, yes. But that's great. But with Middle East, we can go and practice. There are no examinations or nothing to be
Yeah,
done.
we can go. But then if we can settle in their lifestyle, actually Middle East countries are all not good actually. So
Hmm.
like we
Yes,
have
yes,
to choose. We have to choose.
yes. Places maybe like Dubai,
Yeah,
and
Bahrain, I
Bahrain, and it's
yeah.
fine. But yes, all the Middle East countries are not something that you tend to pick up. Yes. So now, when you are practicing as a family medicine, how is your lifestyle on an everyday basis, and what are the challenges that you face, and what are the good things also that you can focus on?
So I am very contented with my job actually,
Okay.
because initially I thought ki I'll be looking only fever cases. What I thought of internist,
Mm-hmm.
but then it's not like that. I'm seeing, as I have pursued that endocrine also. So like it's good. I'm seeing diabetic patient also and general patients also, kind of that. So
Mm-hmm.
and yeah, I have I usually keep myself updated for those general medicine cases also. So that's a good. I enjoy that actually. So
This is the good thing, actually. Glad to know. And what are the challenges that you face?
challenges in a metro is that we have to be in our toes for any like every patient is a special patient. Like
Mm-hmm.
they know each and every bit of every medicine. So
Yes.
once any side effect happens, then why doctor, why was this of that drug? So we
Mm-hmm.
need to explain them.
Mm-hmm.
So everything,
That is the kind of challenge.
yeah,
Maybe so then that is not related to the branch. Maybe that is related to the place,
yeah,
because you
yeah,
are in metro.
that is place related.
But otherwise, when it comes to the branch, you don't find any challenges
No,
with the
no,
branch.
I don't find any challenge. It is good actually. I have so in this era of super speciality, like people cardio is stick to cardio, gastro is stick to gastro, but I could see like variety of patients. So
That's a great thing,
yeah,
actually. Actually.
I enjoy that. I enjoy it.
Mm-hmm. No, glad to know all of this, all of the positives as well as no challenges with the branch is something amazing that I feel that people look forward to, and especially when, everybody's struggling to get into super specialization, getting into a branch where you can get established pretty early and have your practice is another very big thing, I believe, because maximum of the branches you get established after your MCH or DM, and then think of getting established.
Yeah.
So this is the best thing about family medicine, and now there's a boom in family medicine coming in India also, and especially if you plan to move outside India, family physicians are like the first doctors everybody come across with.
Correct.
So
Correct.
yes,
Correct.
so if actually I have spoken to Dr. Neha a lot of times before the interview, and I must tell you that she's so contented with the branch, and if you plan to pick up family medicine, don't think twice, please pick the branch. It will definitely help you to get a good lifestyle and a better work life balance in future. I'm sure all of our viewers must be very happy to know all the insights that you just mentioned, Dr. Neha, because this is something that people look forward to, especially for a branch like family medicine, which is so new, and people are always confused whether to pick that up or not to. Thank you so much for all the insights about this. Also, let's end on a high note about any motivational quote that you want to tell the students who are who are on studying and are practicing. What is it, something that you always follow?
So so it's it's a valid for all the doctors actually,
Hmm.
like family medicine also. So for a doctor, what is motivating is like when his patient satisfaction, and then and how meticulously we treat our patients, and then that patients comes back to us with happy faces saying that doctor, I'm healthy because of your medicines.
Hmm.
So what is that is the that is the contentment when a patient says to me. So like a family physicians, I just reach to their level. Like family physicians is like kind of family, kind of that.
Yes,
So
yes.
I listen to all their personal things also, like,
Hmm.
so that make themselves contented actually with my ideas and all those things. Na? So like they have to be like for a doctor, you have to be like you have to have sympathy for your patients. You have to be very keen what they are saying, what problems they have. We have to be a very good listener also,
Hmm.
apart from like telling our ideas to the patients. We have to be a keen listener, then
Hmm.
only we can succeed, like
Be a better practitioner.
better
Yes,
practitioners.
yes, yes, yes. That's one very important thing. Thank you for actually pointing this out. This is something that I believe we as doctors just miss out in our everyday hustle bustle. But being a keen listener to our patients is something that makes and breaks your practice. That is something that builds that trust and builds that following, and you know patients just stick to you because you are a keen listener is something that everybody of us have seen, I believe. And it's just that we start when it comes to us, we just miss out on this such a small point. And thank you for Dr. Neha to actually help us to revise that and to help us to understand that this is something that we should do it on an everyday basis. Thank you, Dr. Neha, for actually giving us all the insights on family medicine and all about what you have learned in your journey. How has it been? And the best part is to understand about family medicine, which is such a positive branch. And if somebody, I'm actually repeating, if anybody of you plan to pick up this branch, do that, because that is definitely going to give a happy life and a happy work-life balance in future.
Yeah,
Yes.
definitely, definitely.
Yes. So good to know all of this. So thank you so much, everyone, for being here at this time, for listening to us. I'm sure festivities are coming around the corner on the weekend. So, best of luck for all of those. Stay safe, stay happy, stay healthy, be with your family, enjoy the festival, and definitely stay safe in this Diwali. Thank you so much for viewing us at this time. Do share it with your friends and colleagues who are planning to pick up family medicine or are confused what to do in which branch and are still not able to figure that part out. Also, go and watch all our old videos on our Instagram as well as YouTube channels. I'm sure they will help you out in some or the other way in your phase of life. Thank you so much, Dr. Neha, and thank you everyone for joining us. Yeah, thank you. So bye bye, good night, take care, bye bye.
Good night. Good night.